The 𝗺𝗱𝗃 dentistry, root canal treatment. Today we're going to be talking about root canal treatment. According to the World Health Organization, globally, an estimated 2 billion people suffer from caries of the permanent teeth. Now, one thing you need to know is that if you have caries and you do nothing about it and it spreads to the nerve, that is when you will need a root canal treatment or extraction. We'll be covering what is root canal treatment, how knowledge can help, and dental prevention. So, how to identify? It starts with pain, excruciating pain. It keeps you awake at night. That is the sort of pain. In some cases, they develop swelling. It can be a sharp or stabbing pain, prolonged sensitivity, referred pain, or swelling. It can spread to other parts of your body. It can be localized, or in some severe cases, your face may balloon. That is why it is very important to practice dental prevention is better than cure. So how do you prevent it? By visiting the dentist regularly, brushing twice a day, limiting sweet to meal times. Looking at the anatomy of the tooth in the picture, you can see that it's got the outer bit and it's got the root. The top bit is the crown and the root is connected to nerves. That's why when you have a root pain, it's very painful and it keeps you awake at night. And if you ignore it, it can be throbbing. And if you ignore it, it can spread and lead to a swelling. So if you look at caries, is when you decide not to do anything about the caries. So if you have a small caries and you treat it, that is fine. If you ignore it and it hits the nerve, that is when it becomes very, very painful. And you are left with two choices, either to save the tooth or to have the tooth removed. In other words, when you have tooth decay that has gone to the nerve, the complications are pain, the risk pain, alternatives do nothing, which is what a lot of people do, or restore it, or extraction. The pros and cons, the benefit is function. Now, root canal treatment is basically saying that I know my tooth is bad, I'm not in a hurry to have the tooth removed. I would prefer a root canal treatment. Root canal treatment is just buying time. So you can still have the root canal treatment and end up losing the tooth. The other option is extraction, but you know the complications, you'll be left with a gap and things like that. So if you have to save the root of the tooth, you need to see a specialist, an endodontist, because they use a microscope. And the success rate is a little bit higher because they use microscope and they're specialists. Root canal treatments can be quite painful. So in order to prevent it is visit the dentist regularly, limit sweet to meal times, brush twice a day. So analysis. In this picture, you can see the decay at the top. You can see the nerves. This is what causes the pain. So what you want to do is you don't want that decay to hit the nerve. That is why when you have a cavity, it's good to see the dentist as soon as possible to have it restored rather than ignore it and it hitting the nerve. When it hit the nerve, the pain is not nice. It keeps you awake at night. And at times it can spread to the tissues, leading to swelling. The result is when the tooth has been root filled, this is what you will get. So a root filling will involve a lot of stages. So the first stage will be gaining access, cleaning the canals, obturating it, and then making sure that everything is done well. So if you look in that picture, that is a root-filled tooth. In other words, this and normally after root filling, the tooth become brittle. So we do advise people to have it crowned. See you in the next video. Share the knowledge and always practice dental prevention is better than cure. Thank you for staying till the end. Very much appreciated and see you in the next video. Please subscribe for updates. Thank you.